do breasts grow, and which are the most common problems related to breasts?
We enter puberty, our breast starts developing. And the final stage of development of breast usually completes by the age of 21, 23, and depends on the constitution of the person. In the beginning, the breast is not very formed, and most of the time it doesn't have any lesions on it when we're younger, and doesn't have any discharge. But sometimes it could be discharged regardless of your age. It could be a young girl having discharge from the nipples. It could be a woman between ages of 40 and 45. It depends.
What should a woman do in this case?
If you're having discharge after squeezing your nipple, it is normal. But if you have discharge spontaneous, even if you're not touching it, and there's a liquid dripping from the nipple, that is not normal. That is the sign that tells you that you have to see a doctor.
In what frequency should women auto-examine their breasts?
Every woman has to start examining her breast at least after the age of 20, 21. And the best time to examine the breast is after your menstrual period, because breast tissue is very sensitive to hormonal changes. And the most fluctuation of hormones, especially the hormone of progesterone, creates a lot of swelling and tenderness in the breast tissue right before menstrual cycle.
What is the best way for a woman to examine her breasts?
But once we had menstrual cycle completed, the best time to do it on the 7th day after your menstrual cycle. Your breast is less dense and it's easier to palpate and examine. If you're doing it for the first time, especially right before the mirror, so you have to get undressed and look at the shape, look at the size, look at if there are any deformities, or if it's symmetrical. You have to look at the way it looks first to get a baseline. So once you see it, then you have to lift your arm, whether right arm or left arm, and start examining in circulatory fashion. You have to also check in your armpits, your area where all the lymph nodes could be draining if there's any malignancies, and could be enlarged.
Why should women examine their breasts?
In the first time, you may not feel, what you think you're feeling. You may not even have an idea what you're doing. The idea is not for you to start examining and finding things right away. The idea behind self-awareness, self-exam of the breast, is to get to know your body, get familiar, so you would know how your body feels, how your breast tissue feels in general. And maybe, God forbid, but maybe years later, if you develop some lump or something, you will be able to recognize. Otherwise, if you never examined yourself, how are you going to be able to recognize whether this lump was there before or not? In some cases, there is some inflammatory process maybe going on, not necessarily malignant, not necessarily cancerous, and that can increase the size of the lymph nodes too. It's very important to check your breast on a regular basis, at least once a month. And in the beginning, when you're younger, between ages of 20 and 30, the likelihood that you're going to find problems with your breast is very low because you're young. But it's going to develop a good habit of you, first of all, checking yourself on a regular basis, and second, you're going to be familiar with your body.
What should women with a history of breast cancer in their family do to prevent this happening to them?
That woman has to talk to her doctor and see what is causing that breast cancer, because there's a different types of them. There's a gene-related breast cancers, which called BRCA1 and BRCA2, and those cancers are rare. It's only 5% of all the cancers, of breast cancers that we have, but it is very aggressive one, and not every doctor checks for BRCA1 and BRCA2 genes. First, you have to talk to a doctor, and doctor will look into your history, your family history, and according to that will draw the conclusion whether you need it or not.
Which tests help detect cancer before it develops?
The first screening test that is FDA approved in 2006 called HALO test. And this test is based on the idea that breast cancer starts in the duct of the breast tissue, not in actual breast tissue yet. In the duct of the breast, on the milk duct, there are some atypical cells will form first, and then after that, the atypical cell or high-grade cell will travel into the actual breast tissue and then develop breast cancer. So that process may take up to between 5 and 15 years. And that's why this test is recommended way before mammographic age, which is 40.
Which other tests may a woman do to detect breast cancer?
Is if you, again, younger than 40, and if you, on a self-exam, you found a lump, or your doctor during your exams found that there is some cyst or some kind of lesions on your breast. Sonogram is usually recommended due to density of the breast in younger age.
If the woman is older than 40 years old, should she do a mammogram or a sonogram?
For everybody over age of 40, breast exams, like annual breast exams, self-checks every month, and mammograms are recommended. I always tell them a mammogram is, again, it's a compression of the breast tissue and looking at glands on the breast in general. And then if they see everything, if radiologist sees the whole picture and they don't see any lesions, fine. But in some cases, they may not see certain areas, and then they will take the sonogram and go in that area and examine that area with a targeted imaging, which is a sonogram. If you go just with the sonogram, that means you have to go with the probe through the whole area of the breast, more chances actually to miss something. So I think it's a gold standard to start with the mammogram first, and then depends on the findings, maybe proceed with the sonogram.
Can oral contraception and hormone replacement cause cancer?
Taking oral contraceptives that have estrogen definitely will change your breast tissue. And depends on the families of hormones, depends on your genes, depends how sensitive you are. That tissue may change and may increase in size, but in some cases you may develop cysts. In 2002, a study called Women's Health Initiative showed that there is a increased risk on those who had increased risk for breast cancer, for those who had history or active use of hormone replacement therapy. And the study showed that hormone replacement therapy was done in that particular study on the women who were between 55 and 65, and the dosage was also relatively high of hormones. Based on that study, recommendations now to use hormone replacement therapy in menopausal women very, very carefully. Consider all the risk factors of the woman, checking her symptoms and making sure there is talking to patients, making sure that she understands that there's always, we have to weigh between risks and benefits of hormone replacement. It's a very effective treatment for hot flushes and menopausal symptoms, but also has a risk. And we explain to patients what kind of risk it has, risk on breast cancer, risk of the uterine cancer. And after prolonged discussion, patient decides whether she wants to take that risk and go on hormone replacement.
What effects can natural supplements like soy do to us?
Hormone replacement therapy, we knew what kind of hormone we're using, we knew what kind of dosage we're using, we knew how much we're using and which patients are using. With soy, if she ate soy or yams 3 times a week, 4 times a week, how much she ate, how much estrogen from that soy she took into her body, we don't know. There's no good dosing, there's no good control over this particular study, and that's why those studies were a little weak in terms of showing any difference. That's why most of those studies, my opinion, may show good results or bad results, but not necessarily it is true. We don't have a good information about it. We don't have good studies. In my opinion, estrogen is estrogen. You just have to know where it's coming from. And there are some studies that show that estrogen that comes from animal source has higher risk of potential breast cancer compared to those that come from plants. So far, we don't have a good, well-designed, strong study proving that. We have some studies, but it's not completely proving to FDA to say, yes, we could use it as a phytoestrogens. Although we, as a gynecologist, as the doctors, we don't shut outdoors in front of a natural approach.
Can we measure our levels of estrogen during menopause?
There are some doctors who measure it, and again, there is no recommendation. It's not recommended to measure levels of estrogen and correlate that with menopausal symptoms, because oftentimes you see very little amount of estrogen in the body of the woman and she feels absolutely fine. And in other patients you could see almost normal levels of estrogen, what you expect, but she's still having menopausal hot flushes. So that's why we don't have recommendations for that. Some doctors do measure, and some doctors, who, especially those who use bioidentical hormones, they measure levels and they have their own regimens and their own schemes. But again, these are the regimens and formulations that certain doctors developed, shared with other doctors, using it, but not really well studied, and that's why FDA is not approved yet. And that's why it's considered not a gold standard.
Can breast implants contribute to breast cancer?
Depends on the technique. If it's done above the muscle, then the breast tissue also could be underneath the implant. So implant is actually covering the view of the real breast muscle, breast tissue. And if that's the case, then during mammogram, you can see actual breast tissue. It really can obstruct the view of a natural, of the breast tissue, and may affect the diagnosis and increases the risk of missing certain things on the breast. If it is below the breast tissue, that the breast tissue is more exposed, so during the mammogram, it's easy to see. In certain cases, sometimes people have implants and have complications when it's stuck, when it has contractures. And in that case, mammogram, first of all, it's very painful, and second, sometimes not very informative because of the scar tissue obstructing the view too.
Can big breast impact negatively to the woman?
Large breasts may create no problems at all, and patient could be completely happy, great, but sometimes it can create some problems. First of all, it is psychological problems, especially if a young girl, teenager, have big breasts and in school maybe being teased, and she has that in her psyche, and that's why it may create certain personality about this, because of this. Second, after carrying this weight on her shoulders, the weight also falls into her spine, and in order to create a balance between her back and her chest, her muscles of her back have to compensate. And the muscles, if the muscles of the back are not strong enough, they spasm, and that creates chronic back pain, which actually medical indication for reduction, surgical reduction of breast size. And if it is medically indicated, if you really have symptoms, doctor will do it under insurance. Insurance should cover it because it is medical condition.